Gunfire inside a hospital sounds wrong. It doesn't echo like it does in a valley. It cracks off the linoleum, sharp and claustrophobic. 3 armed men thought they were taking an easy target. They didn't know the clumsy rookie nurse changing IV bags used to kick in doors in Fallujah. Antiseptic masked everything, but Claire could still smell the stale brass. It lingered in the cuticles of her fingers, a phantom scent from a life she was supposed to be leaving behind. She fumbled the plastic IV catheter. Again. "You're killing me, Foster," Corporal Dunn grumbled, pulling his heavily tattooed arm back a fraction of an inch. He didn't mean it aggressively. It was the tired, tolerant teasing of a combat marine who had survived a suicide bomber only to be subjected to the medical incompetence of a 26-year-old rookie. Claire forced a tight, apologetic smile. It felt unnatural on her face. "Sorry, Corporal. Dehydration makes the veins roll. Let me try a smaller gauge." Dunn sighed, leaning his head back against the starchy hospital pillow. His left leg ended abruptly halfway down the shin, heavily bandaged and elevated. Next to him, Private First Class Gable snorted, turning a page of a beat-up magazine. Gable was nursing a severe concussion and shrapnel in his shoulder. They were tough kids, annoyingly young. "Maybe if you didn't hold the needle like you're trying to stab a terrorist, you'd get it in," Gable muttered, not looking up. Claire's jaw clenched for a fraction of a second. She relaxed it instantly, deliberately breathing out through her nose. Deep breath. Soft hands. "You are a caregiver." She adjusted her grip on the plastic tubing. Her hands were scarred, the knuckles permanently thickened from years of heavy bags, rope burns, and bare-knuckle sparring. She had spent the last 7 years learning exactly how to destroy the human body with maximum efficiency. Trying to gently insert a 20-gauge needle into a fragile vein without causing pain felt like trying to defuse a bomb with chopsticks. She finally got the flash of dark red in the chamber. Taping it down, she smoothed the adhesive strip with her thumb, stepping back from the bed. "There, all set," she said, her voice lacking the maternal warmth typical of the ward. It came out flat. "Thanks, Florence Nightingale," Dunn smirked. "Hey, could you grab me some ice chips? My throat tastes like sand." "Sure." Claire turned and walked towards the hallway. Her steps were entirely silent. It was a habit she couldn't break. The thick rubber soles of her standard-issue hospital clogs should have squeaked on the freshly waxed linoleum, but she subconsciously rolled her weight from the outside edge of her foot to the toe, absorbing the impact. Captain Lewis, the head nurse, constantly reprimanded her for sneaking up on the staff. The seal blue scrubs chafed against her collarbone. They were too loose, too light. Her body constantly felt off balance without the 40 pounds of ceramic plates, magazines, and radio gear she was accustomed to carrying. Every time she reached up to scratch her shoulder, her hand instinctively grazed the empty space where her comms unit used to be. It was a phantom limb sensation, but for body armor. She pushed through the swinging doors of the break room and leaned over the sink. The water ran cold. She splashed it on her face, staring at her reflection in the cheap, warped mirror above the paper towel dispenser. Her dark hair was pulled back into a severe, utilitarian bun. Dark circles bruised the skin under her eyes. She looked ordinary, exhausted, invisible. That was the whole point. Command had needed a place to stash her after the op in Yemen went sideways. A female operator attached to a Tier 1 team who suddenly found her face plastered on a local insurgent bounty list couldn't exactly go back to base housing in Coronado. So they handed her a fake nursing credential, backed by the combat medic courses she'd blown through years ago, and dumped her in a forward Joint Forces medical facility in the Horn of Africa. "Just lay low, Foster," her commanding officer had told her over a secure line. Take some temperatures, change some bedpans, let the spooks clean up the mess, and we'll pull you out in 6 months. It had been 4 months. She was losing her mind. The door creaked open. Captain Lewis walked in, holding a clipboard like a shield. She was a career Navy nurse, sharp-eyed and perpetually annoyed. "Foster," Lewis barked, dropping the clipboard on the counter. "I just checked your charts for Ward 4. You documented Corporal Dunn's vitals, but you didn't note his pain levels, again." "He said he was fine," Claire replied, wiping her face with a coarse paper towel. "I don't care what he said. You have to ask the scale. 1 to 10. You know the protocol." Lewis sighed, rubbing her temples. "You're stiff, Foster. You treat these boys like they're pieces of machinery that just need an oil change. They need bedside manner. They need a human touch. You act like you've never comforted a patient in your life." Claire tossed the paper towel into the trash. "I haven't," she thought. "Usually when someone is bleeding out in front of me, I'm more worried about returning fire than asking them to rate their pain from 1 to 10. "I'll fix the chart, ma'am," Claire said evenly. "See that you do, and get back out there. Visiting hours are over, and the local contractors are coming through to clean the HVAC units, so it's going to be crowded in the corridors." Claire nodded, stepping past her. She grabbed a plastic cup, filled it with ice from the machine, and walked back out into the bright, sterile hallway. She hated the smell of this place. The bleach and iodine were supposed to represent healing, but to her, they just smelled like a prolonged, agonizing weight. She missed the dirt. She missed the sharp, metallic tang of cold air on a night drop. She missed the clarity of having a target. Here, the enemy was invisible. Infections, phantom pain, PTSD. Things she couldn't shoot, things she couldn't choke out. She stopped outside Ward 4, shifting the cup of ice to her left hand. Then the baseline noise of the hospital changed. Popping. It was faint at first, muffled by the heavy fire doors at the end of the East Wing corridor. A sporadic, dry crack, crack, crack. A civilian would have thought it was construction noise, a dropped pallet of medical supplies, maybe the HVAC contractors dropping heavy tools on the concrete floor. Claire stopped dead. The plastic cup of ice slipped slightly in her palm. Her stomach didn't drop. It turned to ice. Her pupils dilated, her vision instantly tunneling down the long, glossy stretch of hallway. She knew the acoustic difference between a dropped wrench and a 7.62 caliber round being fired indoors. The sharp, concussive snap was unmistakable. It was the sound of a Kalashnikov. "Not here," her brain whispered, a sudden desperate plea against reality. "Please, not here." Another burst, closer this time. 3 distinct shots. Then came the screaming, high, ragged and raw. It was abruptly cut short. Claire's civilian persona shattered in a fraction of a second. The clumsy, soft-spoken rookie nurse vanished, replaced by a cold, hyper-vigilant machine. Her posture shifted instantly. Her shoulders dropped, her center of gravity lowered, and her eyes stopped looking at faces and started scanning for fatal funnels, cover, and lines of sight. She tossed the cup of ice into a nearby linen cart. She needed her hands free. Footsteps, heavy, uncoordinated, but fast. Multiple sets of boots thudding against the linoleum, moving toward the main intersection of the ward. Shouting in Arabic, harsh, aggressive commands. Claire stepped backward into Ward 4, letting the door swing shut silently behind her. Dunn and Gable were sitting up in their beds. The sleepiness was entirely gone from their faces, replaced by the pale, rigid tension of combat veterans who knew exactly what that sound was. "Foster!" Dunn hissed, his voice dropping an octave. "Lock the door!" "It doesn't lock from the inside," Claire said. Her voice wasn't flat anymore. It was dead calm. Too calm. Gable was already trying to rip his IV out. "Where's the MP? There's supposed to be a guard at the checkpoint." "He's dead," Claire stated, not looking at them. She moved quickly to the supply cart by the door. She didn't have a sidearm. She didn't have a knife. She started ripping open drawers. "What?" Dunn strained to pull himself out of bed, his face twisting in agony as his amputated leg shifted. He reached instinctively for a holster that wasn't on his hip. "Listen to me, Foster. Hide. Get in the bathroom. They're hitting the hospital." Claire ignored him. Her hands wrapped around a heavy, solid steel oxygen tank key, a foot-long wrench with a heavy, rounded head used for cracking valves. It weighed about 3 pounds. It wasn't a karambit, but it would crush a skull. She slipped a pair of heavy trauma shears into her left scrub pocket. "Foster, did you hear me?" Dunn barked, panicked by her apparent shock. "Hide!" Heavy boots kicked the swinging doors of the adjacent ward open. Gunfire deafened the hallway. Plaster dusted down from the ceiling tiles above them. There were 3 men. Claire heard their voices clearly now. They were sweeping the rooms, executing the wounded, moving fast before the base quick reaction force could mobilize. They had maybe 2 minutes before the Marines outside formed a perimeter, which meant these men weren't planning on leaving. It was a suicide assault. Maximum casualties. The heavy footsteps stopped right outside Ward 4. Claire flattened herself against the wall beside the doorframe, completely out of the fatal funnel. She regulated her breathing. In for 4. Hold for 4. Out for 4. Her heart rate plummeted. The fear was gone, replaced by a dark, familiar stillness. The door burst open. The first gunman stepped in, rifle raised, sweeping the muzzle toward Dunn's bed. He was wearing mismatched tactical gear, eyes wide with adrenaline, screaming a command. He never finished the sentence. Claire moved with explosive, terrifying violence. She didn't scream. She didn't hesitate. She stepped out of the blind spot and swung the steel oxygen wrench with every ounce of torque in her shoulders. The heavy metal struck the side of the gunman's knee with a sickening, wet crunch. The joint collapsed inward. As the man screamed and dropped his elevation, Claire didn't back away. She stepped into him. She grabbed the hot barrel of his AK-47 with her bare left hand, violently redirecting it toward the ceiling as his finger jerked the trigger. Deafening shots tore into the fluorescent lights, showering the room in glass and sparks. Simultaneously, Claire drove the heavy steel wrench upward into the soft triangle just beneath his jawline. Bones snapped. The man choked, his eyes rolling back. He was dead weight, but his hand was still clamped on the rifle. The second gunman was already pushing through the door behind him, his weapon coming up. Claire didn't have time to wrestle the gun free. She shoved the collapsing dead man forward, directly into the second gunman, creating a temporary fleshy barricade. As the second man stumbled back, cursing, Claire reached into her pocket, pulled the trauma shears, and lunged. It wasn't clean. It wasn't like the movies. It was brutal, slippery, and desperate. She drove the blunt steel blades of the shears deep into the gap between his body armor and his collarbone, severing the subclavian artery. Hot, dark liquid sprayed across her face and the chest of her blue scrubs. The man gasped, dropping his rifle to clutch his neck. Claire grabbed the back of his tactical vest, pivoted, and threw him hard into the wall. He slid to the linoleum, gurgling. The whole sequence took less than 4 seconds. The room fell into a heavy, ringing silence, save for the hum of a damaged heart monitor and the wet sounds of the dying man on the floor. The smell of copper and burnt gunpowder violently erased the scent of antiseptic. Claire stood over the bodies. Her chest heaved once, twice. She wiped the blood from her eyes with the back of a shaking hand. It wasn't fear making her shake. It was the massive dump of adrenaline fighting the rigid control she was forcing back over her body. She bent down and picked up the dropped AK-47. Her hands, the same hands that had awkwardly fumbled a simple IV minutes ago, moved in a blur of practiced precision. She dropped the magazine, checked the brass, slammed it back in, racked the charging handle, and swept the selector switch to semi-automatic. She brought the stock tight to her shoulder, sweeping the empty hallway through the cracked door. Clear. Only then did she look back at the beds. Dunn and Gable were frozen. Their mouths were slightly open, their eyes wide, staring at the woman covered in blood, holding a terrorist's rifle, like it was an extension of her own arm. The soft, clumsy rookie nurse was gone. The woman standing in front of them had dead, flat eyes that had seen the worst the world had to offer, and had clearly participated in it. "Foster," Dunn whispered, his voice cracking. "What the hell are you?" Claire didn't smile. She didn't offer a clever quip. She kept her eyes locked on the hallway door. "I'm your nurse, Corporal," she said, her voice like grinding stone. "Keep quiet." Gunpowder hung in the shattered room, heavy and biting, tasting like dry rust on the back of her tongue. Claire kept the captured rifle leveled at the hallway. Her breathing was a shallow, controlled hiss. Two men lay on the floor, their life leaking into the grout lines of the tiles. But her ears were straining for the third. She had heard 3 distinct sets of heavy boots kicking the floorboards. Dunn gasped behind her, a wet, choking sound. She snapped her head back for a fraction of a second. Dunn was struggling to sit up, his heavy hands gripping the metal bed rails, his face the color of wet ash. "Gable," he grunted, kicking the younger Marine with his good foot. "Get off the mattress, now!" Gable was frozen, his eyes blown wide, locked on the dark puddle spreading across the linoleum. Concussion protocol went out the window. Claire dropped to one knee, keeping the barrel trained on the door, and reached backward, grabbing a fistful of Gable's uniform shirt. She yanked him violently. He tumbled off the bed with a heavy thud, hitting the floor hard enough to knock the wind out of him. "Stay flat," she ordered. The voice didn't belong to a caregiver. It was a tactical command, carrying the sharp, unforgiving edge of a master chief. She crawled toward Dunn, her knees soaked up the dark, sticky warmth pooling on the floor. She ignored the sensation. "Corporal, we have to move. They know this ward isn't clear." "Move where?" Dunn gritted his teeth, gesturing to his heavily bandaged stump. "I'm missing a wheel, Foster." "You're going to use my shoulder, and you're going to hop. We're getting to the east stairwell. It's thick concrete, fire doors." A sharp burst of static crackled from the tactical radio strapped to the chest of the dead man blocking the doorway. A harsh voice barked a phrase in Arabic. "Where are you? Report." Claire didn't speak the dialect perfectly, but she understood the tone. Impatience. They were running out of time. The base QRF would be mobilizing, which meant these men were about to rush their clearing operation. She slung the AK-47 over her back, using the dead man's canvas strap. It dug into her collarbone, a harsh, familiar friction against the thin fabric of her scrubs. She reached over and ripped the heavy, yellow portable defibrillator off the crash cart bolted to the wall. It was a bulky, older model. 30 pounds of hard plastic, capacitors, and thick rubber cables. "Grab my waist," she told Dunn. He didn't argue. The cynical, teasing Marine was gone. He clamped his thick, tattooed forearm around her ribs. She hauled him upright, her own joints protesting under the sudden, immense weight of a grown man deadlifting himself on one leg. Gable, get up, you're on point, Claire snapped. Don't look at the bodies, look at the exit sign. They shuffled into the hallway. The fluorescent lights overhead flickered, damaged by the stray rounds. The corridor was a mess of abandoned medical carts, scattered pill bottles, and discarded clipboards. Footsteps echoed from the north intersection. Heavy, running. Stairwell. Now, Claire whispered, shoving Gable forward. They reached the heavy steel fire door. Gable pushed it open, stumbling into the cool, dark concrete shaft. Dunn hopped through, panting heavily, the exertion tearing at his fresh surgical sutures. Claire followed, letting the heavy door click shut behind them, cutting off the noise of the ward. The stairwell smelled like old dust and damp cement. It was a sensory deprivation chamber compared to the chaos outside, but it was a trap if someone came from above or below. Claire eased Dunn down onto the landing. "Keep pressure on your leg," she murmured. Her hands were shaking again. She hated it. The adrenaline crash was fighting her training. She pressed her knuckles against the cold concrete to steady them. The heavy steel door of the floor below them shuddered. Someone was pulling the handle. Claire unslung the AK. She racked the bolt. Nothing happened. She ripped the magazine out. It was jammed. A crushed brass casing was wedged horizontally in the chamber. A catastrophic failure typical of poorly maintained surplus weapons. She cursed silently, tossing the useless hunk of metal onto the stairs. The door below them groaned open. The rhythmic clack-clack of tactical boots ascending the concrete steps echoed off the walls. One man, moving fast. Claire looked at her empty hands, then at the heavy yellow defibrillator resting next to Dunn's knee. "Corporal," she whispered, her voice tighter now. "Turn it on. Maximum charge." Dunn stared at her. "What?" "Turn the dial to 360 joules and press the charge button. Do it." He fumbled with the dials. A high-pitched, rising whine began to fill the stairwell. "Whee!" Claire ripped the two heavy paddles from their holsters. She didn't apply the conductive gel. She just held the hard plastic grips, pressing her back against the wall right beside the doorway of their landing. The footsteps stopped. The man below had heard the electronic whine. He was advancing slower now, cautious, raising his weapon. The barrel of an assault rifle peeked around the corner of the stairs, followed by a dark, bearded face, eyes sweeping the shadows. He saw Dunn and Gable huddled on the landing. He raised the rifle. Claire didn't give him the chance to pull the trigger. She launched herself off the wall, dropping directly onto the man from the step above. Her knees slammed into his chest armor, knocking the wind out of him in a sharp hiss. They crashed backward onto the concrete stairs in a tangle of limbs and hard angles. The man grunted, releasing his rifle to shove her off. He was strong, fueled by fanaticism and adrenaline. He managed to throw Claire against the iron railing, his hand dropping to a combat knife strapped to his thigh. Claire didn't fight his momentum. She scrambled up, her bare hands gripping the defibrillator paddles. The man lunged, the heavy steel blade arcing toward her ribs. Claire sidestepped, driving her left hand forward. She slammed the first paddle directly into the side of his neck, right over the carotid artery. She smashed the second paddle into his exposed jawline. "Clear!" she snarled, and hit the shock buttons on both grips simultaneously. Crack! The sound was like a whip snapping in a small room. 360 joules of raw, unfiltered electricity surged directly through the man's nervous system. His body locked instantly. Every muscle in his frame contracted with violent, bone-breaking force. His eyes rolled back into his skull. A harsh, unnatural vibration tore through him. and the sharp scent of burning hair and ozone instantly overpowered the smell of damp dust. He dropped like a stone, tumbling down 4 steps before coming to a dead, twitching halt. Claire stood over him, chest heaving, the yellow cables dangling from her hands like severed mechanical veins. Her breath came in ragged, uneven gasps. The silence rushed back in, broken only by the quiet, steady beep of the defibrillator resetting. She dropped the paddles. They clattered noisily against the concrete. Up on the landing, Dunn and Gable stared at her. They looked more terrified of her than they had of the gunman. Claire leaned against the cold iron railing, wiping a streak of red from her cheekbone. "Pain level, Corporal?" she asked, her voice trembling slightly before she forced it back into a flat, emotionless register. 1 to 10. Dunn just swallowed hard. A 2. Ma'am. Vibrations shook the concrete beneath Claire's feet. Boots, dozens of them. Not the uncoordinated stomping of insurgents, but the synchronized, heavy cadence of United States Marines moving with overwhelming intent. "Friendly!" Gable screamed, his voice cracking violently. "Friendly in the stairwell! Don't shoot!" The fire door below them burst open, violently slamming against the wall. Flashlights cut through the dimness, blindingly bright, sweeping over the scorched body on the stairs, then snapping up to the landing. Red laser dots danced across Claire's chest. "Drop it! Show me your hands!" A heavily armored Marine bellowed, his rifle locked onto her center of mass. Claire didn't freeze, and she didn't make a sudden movement. She raised her empty hands slowly, keeping her palms open and her fingers splayed. Her posture was perfectly non-threatening, a calculated surrender. "Hands are up," she said, her voice projecting clearly over the shouting. "Unarmed. 2 friendly casualties behind me. Ward 4 is compromised. 2 hostile KIA inside." The lead Marine, a grizzled staff sergeant, lowered his weapon slightly, his eyes darting from the ruined, smoking body on the stairs to the young woman in the oversized, horribly stained blue scrubs. The cognitive dissonance on his face was visible even behind his ballistic glasses. He stepped over the body, 2 other Marines moving past him to secure the floor above. The sergeant looked at Claire, then at Dunn. "Corporal Dunn," the sergeant said, his voice tight. "Report. Who is this?" Dunn looked up from the floor, his face pale, his jaw set. He looked at Claire. He looked at the bruised knuckles, the flat, dead expression, the perfect tactical composure. "That's Foster, Staff Sergeant," Dunn said, his voice full of a strange, bewildered reverence. She's our nurse." The QRF secured the hospital in under 12 minutes. The remaining insurgents in the lobby had been dispatched by the perimeter guards. The chaos slowly subsided into the grim, bureaucratic machinery of a post-combat mop-up. An hour later, the sharp tang of antiseptic had returned to the corridors, battling the lingering scent of copper and burnt powder. Claire sat on a folding chair in the empty staff locker room. The overhead fluorescent light hummed relentlessly. A grey wool blanket was draped over her shoulders, though she wasn't cold. She was just incredibly, overwhelmingly tired. The door swung open. Captain Lewis walked in. The older nurse looked shaken, her uniform rumpled, but she maintained her rigid posture. She held a fresh set of scrubs. Lewis didn't say anything at first. She walked over, set the clean clothes on the bench next to Claire, and stood there. "I spoke with the base commander," Lewis said quietly. Her voice lacked its usual bite. "And a man in a suit who wouldn't give me his name. They told me you're being transferred. Tonight." Claire kept her eyes on the floor tiles. "Yes, ma'am." Lewis looked at the heavy stains soaking the front of Claire's uniform. She looked at the bruised, swollen knuckles resting on Claire's lap. The older woman sighed, a long, weary sound. "You saved my boys today, Foster," Lewis said, her tone softening, stripping away the rank and the reprimands. "Dunn and Gable. They told me what happened, what you did." Claire finally looked up. Her eyes were hollow, reflecting the harsh light. She didn't feel like a savior. She just felt the phantom weight of the armor she wasn't wearing, the familiar, isolating cold of a world she couldn't escape. "I missed a vein this morning," Claire said softly, the contradiction tearing at her chest. "I caused him pain." Lewis shook her head slowly, stepping forward to rest a warm, steady hand on Claire's shoulder. "You kept him breathing," Lewis said firmly. "That's the only metric that matters in this ward." Claire nodded once, closing her eyes. The ringing in her ears slowly faded, replaced by the quiet, steady rhythm of the hospital heartbeat, stubbornly ticking on. If Claire's ruthless instinct and that defibrillator scene had your heart pounding, smash that like button and subscribe for more intense, grounded, tactical stories. We want to hear from you. Did the Marines' reaction to their rookie nurse hit the mark? Drop your thoughts in the comments below. Don't forget to share this video with anyone who loves raw, action-packed military fiction. Hit the notification bell so you never miss a drop. Stay sharp, and we'll see you in the next one.